Attention ASRM Today listeners, are you ready for the event of the year? Register now for the ASRM 2023 Scientific Congress and Expo, the premier conference for reproductive medicine happening in New Orleans, Louisiana, October the 14th through the 18th. Get ready to immerse yourself in cutting-edge scientific sessions, engaging workshops, and once-a-year networking opportunities. Discover the latest breakthrough in reproductive science, exchange ideas with industry leaders, and expand your clinical knowledge. With over 200 expert speakers and hundreds of exhibitors showcasing the latest advancements in reproductive technology, this is the event you cannot afford to miss. Mark your calendar and register now for ASRM 2023 New Orleans by visiting www.asrmcongress.org. On with the show.
Welcome to ASRM Today, a podcast that takes a deeper dive into the current topics in reproductive medicine.
I'm Jeffrey Hayes. Today on the show, we're discussing fertility preservation in male cancer patients. Our guest for this is Dr. Omer Raheem, who is Assistant Professor of Surgery in Urology, the University of Chicago Medical Center, Pritzker School of Medicine. Dr. Raheem, welcome to ASRM Today.
Thank you so much, Jeffrey.
So as it is tradition here on the program, I always ask my first-time guests, how did you come to be in the field?
Well, thank you, first of all, Jeffrey, for this wonderful opportunity from ASRM and SMRU. It's an honor to be here, sharing my own experience and research that has been going on at the University of Chicago. To tell you the truth, initially when I was going through training in urology during my residency, always really liked the idea of improving the quality of life of men, specifically men who suffer from reproductive health issues, men who suffer from cancer therapy or cancer itself has impact on reproductive health for men. So I really wanted to be a specialized urologist who can take care of those men who suffer from cancer or even treated from cancer and help them improve the quality of life. And that's really kind of opened my eyes to the field, and I'm very excited to be part of that. And to be honest with you, also from my own experience and from my own personal experience, I should say, my wife developed ovarian cancer that at a young age after our child was born. And that kind of led to a series of treatment that she undergone, including surgery, radiation, and chemotherapy, which rendered her infertile for life, as you may imagine. That also kind of hit close to me, very close person and dearest person in my life, having gone through treatment and see her suffer from really mostly reproductive health issues that she has to deal with. And that's also kind of really consolidated my beliefs and my future plans to be very specialized in this area.
Well, thank you for sharing that. You've felt it, you work in it professionally, but yet you've had experience in your personal life, as well as in urology. And I know you want to share some data that you have collected for us to share with us today. What are some strategies for male cancer patients?
And it's very important also, and thank you for asking, Jeffrey. I think for men and for their families, it's important to highlight those strategies that we often discuss in patients when they come and see us with cancer diagnosis. And typically the consults would start from educating the patient, counseling them, evaluating them for their potential, like what options they have in terms of preserving fertility. Oftentimes men come to see us and they feel that the end is near with the cancer diagnosis, but they really it's important to educate them and evaluate them for what options available. And it starts with the sperm banking, which is very simple and cheap and very kind of important step that initially patients should undergo. Those sperm banking or sperm preservation or cryopreservation can be used for life. It can be resources for the couple for the future. Oftentimes, if patients they cannot ejaculate because they are too young, or they have conditions that prevent them from ejaculation, like for example, retroejaculation, which is a common condition with cancer or cancer therapy, or in ejaculation, inability to ejaculate at all. There are ways of retrieving sperm directly from your urine, or by doing a little procedure, a surgical procedure where we retrieved sperm directly from a tissue of the testicle by opening the testicular tissue and harvesting those tissue that contain sperm, obviously needing some resources, local resources where this tissue and sperm can be preserved in a special lab that can be utilized in the future for the assisted reproductive technology like IVF or ICSI.
Does age play a specific role? Is there a specific age group that we look at? You know, I'm 46. I'm a little bit past time for me and my wife to have children, but I'm just curious, are there prime ranges here of maybe like 18 to 35 or something along those lines?
I mean, we with men with cancer, they present in different age groups. Pubertal or adolescent or even adult men. There's no age cutoff, obviously. If you're able to ejaculate and provide a sample by simply masturbation, this sample will be preserved and will be checked for quality of the sperm. If they're deemed good to be preserved, then oftentimes the lab will preserve it. We often require multiple multiple ejaculation times to collect the best samples or best quality of sperm. So there's no age cutoff. Obviously, a patient going through like chemotherapy, for example, treatment, we wait for about 6 months to obtain a sample to ensure there is recovery of sperm. Number one. Number two, there's a good sperm we can preserve. Again, this is for men who did not cryopreserve their sperm before the chemotherapy, which is oftentimes the case.
Why is it oftentimes the case? Is it just because of not having the option, or?
And that's exactly what I really wanted to kind of point out in doing this podcast. Is really important to educate our men with cancer diagnosis, right? And it starts with us spreading the word that it's important to educate those younger patients, younger men, that they need to preserve sperm. They need to ejaculate, they need to masturbate, and preserve the sperm in a special labs at the time of diagnosis, right? Because that will protect them for life, for fertility preservation, right? And we know that, unfortunately, with everything going on right now, obviously with a focus on cancer therapy, right? I mean, everybody's is kind of focusing on that and the survival from cancer therapy or cancer itself, taking kind of the helm, if you will, and neglecting other important aspect, which is the fertility preservation. So start with educating our doctors and our patients who see those patients. We know the effect of cancer can be systemic as well as local to the testes. It can disrupt the hormonal as well as the mechanism by which sperm will be produced. So preserving sperm ahead of time before the chemotherapy or radiation or surgery is planned is very important. In a recent survey, actually, if I may, I'll give you some data, showed that only a third of patients preserve actually sperm or bank sperm before cancer therapy, which is very, very, low. If you look at all men who develop kind of cancer, so only a third will preserve sperm. So the point really is to educate our men to preserve and sperm bank before treatment.
Based on research and talking with providers and whatnot, I was curious along these lines, is it too difficult sometimes a conversation to have with a patient, do you think? To say, here you've been given this horrible diagnosis, of cancer, and how do we delicately bridge the gap to say, you also need to be thinking about this, or these
right.
sorts of things.
Yeah, I think you pointed out nicely there the difficult conversation, right, at the time of the diagnosis, or maybe after. Men often overwhelmed with the diagnosis of cancer. There's no time, oftentimes, right? There's no time. They just want to go ahead and do the chemotherapy, for example, right? A diagnosis of lymphoma, for example, right? They want to just go ahead and do the chemo. So I think time is important. Also the cost of testing and preserving can be an issue. Also, the resources available. Not all the hospitals have for example, andrology or semen analysis lab or even IVF lab, right? So the patients or the men need to make an effort to give a sample, pay for it, and then also preserve. So it's a lot of logistical things can actually become a barrier for men to preserve sperm. And obviously, this is an ongoing issue. I mean, I think there's a lot of effort from our societies, the American Urological Association, the American Society of Reproductive Medicine, as well as the Society of for Male Reproductive and Urology, which is kind of works under the umbrella of ASRM, making kind of an effort to make this as a kind of almost a guideline and streamline kind of process where men should preserve their fertility or their sperm before they go into chemotherapy and other surgical treatment for cancer.
My guest today is Dr. Omer Raheem. We are talking about fertility preservation in male cancer patients. I want to ask you, because we were talking just a little bit before we started recording, that you said that you have some data that you would like to share with the audience. So I open the floor to you with that.
Thank you, Jeffrey. This is exciting. Obviously, this is a very vital, important topic. We're talking about fertility preservation for men who are undergoing cancer therapy. And we know that cancer is really important condition we treat for our men. And the research in this area can be limited as well because of resources and funding. But at the University of Chicago, we're very interested in looking at the preservation of fertility for younger kids, typically pediatric population at the prepubertal age, to try to develop an animal model study whereby we looking at the preservation and regeneration or restoration of fertility for the younger patients. For example, patients with leukemia or lymphoma who oftentimes get a chemotoxic or chemotherapy toxic agent that can be very harmful for the testes. So we're developing an animal model whereby we're injecting stem cell with exosomes that could potentially protect against stem cell toxicity and damage before the patient or before the pediatric patient receive chemotherapy. So it's a clear combination of stem cell approach, leveraging the advantage of exosomal as well as stem cell, allogenic stem cells that injected inside the testicle to protect the environment, if you will, for the testes for those patients from getting exposed to chemotherapy.
Is there anywhere that we can post a link in our show notes too for people to look deeper into this, or is it yet to be actually?
No, absolutely. It's a ongoing research at the labs of the University of Chicago in collaboration with the molecular labs here, and we have presented actually these abstracts in different international conferences. And also we have submitted two abstracts on this program to the ASRM upcoming meeting in New Orleans in October of this year. So definitely we're happy to share links with you.
Well, we will have to wait on that, and it sounds very exciting because I know we're all looking forward to all the wonderful presentations that are going to happen in New Orleans. Now, you are part of SMRU, and I'd be remiss not to ask for our audience, since we reach a much broader audience here, could you just tell our audience a little bit about what SMRU is about?
So SMRU stands for Society for Male Reproduction and Urology. Really, it works under the umbrella of ASRM to promote and advance our understanding of male reproduction, physiology, and management of male fertility by providing really a forum of discussion and dissemination of information that is more geared to a basic science as well as clinical science information that geared to a male infertility. Which is important kind of aspect of the couple fertility as a whole. So really, there's a panel of very wonderful, talented young reproductive urologists who are leading the way in this area and providing a lot of research and resources and educational material to educate our men about the male factor infertility issues that could happen during their treatment for infertility.
And for more follow-up on SMRU and all the goings on there, we'll put a link in our show notes for people to click on. That'll take them to the website and give them more direct information. Before we run out of time today, Dr. Raheem, is there anything that in 2023 that you're looking forward to as far as research or anything that's coming down the pipe that perhaps you can let us in on?
Absolutely, is all exciting news. I think I just shared with you our ongoing research in the fertility preservation and fertility restoration kind of world. We are very excited to present that hopefully in New Orleans at the ASRM annual meeting coming up in October. And also there's really a lot of activities within the ASRM meeting pertaining to a SMRU program that we're looking forward to see and be part of as well. So stay tuned for the meeting and the program coming up in ASRM and SMRU in 2023.
People can't see it. My fingers are crossed. See, that's how it's. So keep it to the side there. My guest today has been Dr. Omer Raheem. We have been discussing fertility preservation in male cancer patients. Thank you so much for being able to come on the show.
Absolutely. Thank you. It's a pleasure and honor to be here. Thank you.
Thank you so much. And again, thank you everyone listening. Please rate and subscribe the show on Apple, Google, or wherever it is you get your podcasting needs from. I'm not here to tell you where to download these things. As always, if you have questions, you can email us asrm@asrm.org. And until next time, I'm Jeffrey Hayes, and this is ASRM Today.
This concludes this episode of ASRM Today. For show notes, author information, and discussions, go to asrmtoday.org. This material is copyrighted by the American Society for Reproductive Medicine and may not be reproduced or used without express consent from ASRM. ASRM Today series podcasts are supported in part by the ASRM Corporate Member Council.
The information and opinions expressed in this podcast do not necessarily reflect those of ASRM and its affiliates. These are provided as a source of general information and are not a substitute for consultation with a physician.